Let us pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and parliaments for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor us, your servants, whom you've been pleased to call to the performance of important trusts in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country, and of those whose interests you've committed to our charge. Amen. Next order.
Order number 1, administration of oath.
Next order.
Order number 2, communication from the chair.
Mr. Speaker.
Honorable members.
Mr. Speaker.
Have your seat, Honorable Member for Shabab. Honorable members, there is a communication from the Ministry of Lands, Public Works, Housing and Urban Development. That is the State Department for Housing and Urban Development. There is a notification about the regulations, that is the drafting of the regulations for the affordable housing regulations for 2024. We've just received this communication, and honorable members are notified that the public participation is taking place today in Nakuru at the regional commissioners, that is the plenary hall for the former PC, the formerly known as PC's offices, nowadays known as the regional commissioners' offices. Now in the plenary hall, that's where the public participation will be taking place. After this sitting, the notice or the invitation will be circulated in the members' WhatsApp pages. Thank you. Honorable Adye, what is it?
Mr. Speaker, the system seems not to be working, some of these tablets. I don't know what is the problem, Mr. Speaker. And it's a new system that should be any day in good working condition before we even get into this house, Mr. Speaker. Kindly intervene.
Is it working now?
No, it is not.
But I'm able to hear you from where you...
No, I'm saying we cannot be able to follow up the proceedings.
From the screen?
Yes.
Okay. Sergeant, confirm whether... Thank you, Honorable Wadhie, for that information. The Department of ICT and Hansard will be hands-on so that now we can have seamless services Thank you. Next order.
Order number 3, messages.
There is no message. Next order.
Order number 4, petitions.
There are no petitions. Next order.
Order number 5, papers.
There are no papers. Next order.
Order number 6, notices of motion.
There is a notice of, it's a substantive motion.
Order number 7, statements.
Next order.
Order number 8, motion.
There is a motion by the Honorable Chairperson, Committee on Health Services.
Thank you, Mr. Speaker, sir. I am Honorable John Mwangi, the member for Turi, as well as the member of Health Committee, standing here on behalf of the Honorable Chair, Mr. Jogona Mwaura, to give the report on the visit to Mariashoni Health Center. I beg to move. Committee mandate. The Sectoral Committee on Health Services is established under the second schedule of the County Assembly of Nakuru Standing Orders and is mandated to deal with all matters related to county health services, including in particular county health facilities and pharmacies, ambulance services, promotion of primary health care, licensing and control of undertakings that sell food to the public, crematories, funeral parlors, and crematoria, licensing of dogs and facility for the accommodation, care and burial of animals, water and sanitation services, refuse, dump, and solid waste removal. The committee membership is as follows. Objective of the visit. The objective of the visit was, number 1, to assess the status of the health facility. Number 2, ascertain on the quality of services offered to the members of the public. Number 3, highlight the achievement of the hospital, challenges and areas of improvement as far as delivery of services is concerned. Acknowledgement. Honorable Speaker, I wish to thank the members of this committee for their commitment during the committee visit to Mariashoni Health Center on 24th of May, 2023. I also wish to thank the Office of the Speaker and the clerk for their facilitation during the visit. On behalf of the Committee on Health Services, it is my pleasure and duty to present the report of the committee visit to Mariashoni Health Center. Honorable Speaker, Mariashoni Health Center is located in Mariashoni Ward, Moro Sub-County, Nakuru County. The facility was officially opened by His Excellency Kenneth Mbogwa on 7th February 2017 as a dispensary. In the year 2020, the dispensary was among the facilities that were elevated to a health center. It has a catchment population of 10,000 and it offers services to the public under the County Department of Health Services. It lies on a 5-acre piece of land and the facility has no ownership document or no title deed. Below is the picture of the members of the committee together with the secretariat who were able to pay the visit to the facility. Services and patients served at Mariashoni Health Center. The facility offers outpatient services, comprehensive care clinic services, maternal and child health, antenatal clinic, and family planning services. Approximately 300 patients per day receive outpatient services and 15 deliveries are done per month. It was noted that the maternal child health services are high. However, the deliveries are low, mainly because they are done at home due to the cultural beliefs of the resident. Staff establishment. The facility has 1 clinical officer and 3 nurses. Staff are very critical in the health facilities for them to function optimally. However, in Mariashoni Health Center, there was acute shortage of staff despite the facility being extremely busy. Physical visit at Mariashoni Health Center. Consultation room. The consultation room is the most critical part of the hospital, and in the facility, they serve 300 patients per day. This is where the doctor or clinical officer discusses the patient health issues. The facility has a small consulting room, which double up as an injection room, dressing room, and procedure. So the picture are below there for the consultation rooms. The consultation room in Marishoni Health Center is as above. Maternity wing. The facility has a modern maternity which was operationalized in 2017. The maternity wing has a bed capacity of 10 to 15 deliveries, which are done per month. It was noted that the facility registered all delivery because of the surrounding community's cultural practice of having home delivery. So we have the picture there of the maternity wing and the maternal child health clinic there. Pharmacy. Despite the facility having a pharmacy, it lacks adequate supply of drugs. In a situation where drugs are available, the clinical officer double up as the pharmacist. Laboratory. Clinical laboratory in healthcare facility provides a wide range of laboratory procedure which aid in carrying out of the diagnosis, treatment, and management of patients. The facility has a laboratory which is fully equipped, but they don't have a lab technician. Committee findings and observations. Honorable Speaker, the following are the findings and observations that were highlighted by the committee and management of the hospital during the visit. Number one, the hospital yard has no title deed. Number two, there is acute shortage of staff. Number three, they have a fully equipped laboratory, but they do not have a lab technician. Number four, the facility has a pharmacy without pharmacist or pharmacy technician. Number five, there is inadequate supply of drug in the facility. Number six, housing for the staff is a challenge. The available one within the hospital is servant quarter occupied by a government official who is not a staff of Marishoni Health Center. Number seven, the facility does not have a permanent source of water and depends heavily on rain water. Committee recommendations. Honorable Speaker, from the above observation and findings, the committee made the following recommendation. Number one, that the county government of Nakuru should fast-track issues of title deed to the facility. Number two, that the county government of Nakuru should provide adequate health staff in the facility. Number three, that the county government through the Department of Health should ensure that there is an efficient and timely distribution of drug to health facilities. Number four, that the Department of Health and the hospital management should provide adequate housing for its staff. Number five, that the county government should provide sufficient water to the hospital. So, thank you, Mr. Speaker. I now request Honorable Murage to second.
Thank you. Honorable Murage.
Thank you, Mr. Speaker. I raise to second the report on Marishoni Hospital. Thank you.
Thank you. The motion is properly seconded, and the motion is open for debate. The honorable member for Shabab, the honorable member for Malewa, and then we are going to go on the other side.
Thank you, Mr. Speaker. First, I want to congratulate the Committee on Health for the good work that they have done and for bringing us this report, which is giving us a limelight of how the situation is in Marishoni, Mr. Speaker. Mr. Speaker, among the things that I've seen is that the health center was opened in 2017, Mr. Speaker, and it has low delivery. This is due to cultural beliefs. I'd like to commend the area MCA to try and sensitize the public in Marishoni and maybe advocate for the hospital to be used and to shun the home delivery, Mr. Speaker. At this age, this century, Mr. Speaker, I don't believe it is in order for people to get to give birth at home. Yet there is a health center at the said area, Mr. Speaker. So, Mr. Speaker, I'd like to request even the county government to make sure they move with speed to sensitize the people of Marishoni about the importance of having that health center and maternity wing in that area, Mr. Speaker. Mr. Speaker, on the other side, I can see that they have a pharmacy, and the clinical officer, Mr. Speaker, acts at the same time as the pharmacist, Mr. Speaker. Mr. Speaker, the county government should also move with speed and employ a pharmacist so that the facility can be fully operational, Mr. Speaker. We cannot be having a clinical officer working at the same time as a pharmacist. And again, sometimes, if you go there, sometimes you'll get the clinical officer again doing other functions. He'll not be able to service people diligently, Mr. Speaker. So we request the county government through the health ministry to employ staff for the pharmacists in that institution, Mr. Speaker. They also have a lab, and they don't have a lab technician, Mr. Speaker. The county government should also move with speed and do the same. There is need for supply of water at the health center, Mr. Speaker. Up to this time, they are still using rainwater, Mr. Speaker. Mr. Speaker, hii mambo ya kutumia maji ya mvua naona kama ni mambo ya zamani sana, Mr. Speaker. It is upon the county government to move in and drill a borehole at the facility so that they can have adequate supply of water that will assist in the works that needs water in the facility. They can even have a borehole that is even supplying water to the neighboring community. This would be a CSR from the county government. So I'd like to request the county government to move with speed and look into the recommendations of the committee, Mr. Speaker. Thank you, Mr. Speaker.
The member for Malewa West.
Thank you, Mr. Speaker. I raise to support this motion. And being a member of Committee on Health, Mr. Speaker, the issue of lacking the title deed from our facility, if you look well on this facility, it lacks the title deed. So if we can ask who is the legit owner of this facility. And according to the facilities that we have visited in most of our county, we find out that most of the facility lack the title deed, of which this issue should be taken seriously. And I think the Waziri Rans should address this issue and take it as a matter of urgency. Outside this facility, Mr. Speaker, we are facing this problem. Also, understaffing in our facility, Mr. Speaker. You see in this facility, as Mheshimiwa Wadhiai have just indicated, the pharmacist, we don't have even the clinical officer. Why are we having, or why are most of our facilities are being understaffed? This is a problem that was observed in that facility. Also, how are we expecting this facility to run? How, Mr. Speaker, if you look in it, no water there. And you know, water enhances or makes sure that there is cleanliness in that facility. So the nature and the standard of that facility, due to lack of water, Mr. Speaker, it's not in good state. I therefore raise to support this motion. Thank you, Mr. Speaker.
Thank you. The member for Menengai West.
East, Mr. Speaker.
Menengai East, sorry for that. And then we are going to come back on this side.
Thank you, Mr. Speaker. I'm rising to support this document, the motion. Mr. Speaker, one of the things that we have realized with this institution, that is the dispensary at Mariashoni, is that there are so many deliveries that are also done at home. And Mr. Speaker, there is a high time the Department of Health do a lot of civic education to the people surrounding that area, so that they can note the importance of doing delivery at a hospital, so that they can also reduce the fatalities of the young kids, Mr. Speaker, other than doing the casual practice that they are doing at their homes. Also, Mr. Speaker, it is a shame to the county government of Nakuru having constructing an institution where there is no title deed. Mr. Speaker, we may find one day somebody coming from nowhere and claiming the land, whereby we have put a lot of money, Mr. Speaker. When you check on this facility is well equipped, and we may lose a lot as a county government, Mr. Speaker. The other thing, Mr. Speaker, is that with the equipping of this facility, you find that there is no personnel, Mr. Speaker, and you wonder, why are we allocating a lot of money in the Department of Health? It means that we don't prioritize. The first priority that we could have given to this facility is the personnel, Mr. Speaker. Making sure that we have the infrastructure means nothing if at all that institution is not giving the services to the patients or the services to the nearby members of the public. So, Mr. Speaker, we need to make sure that the Department of Health fast track in giving out the services to the people of Mariashoni. We know Mariashoni is I don't know when we can call it, is it inland. It's so interior, whereby they can't even, maybe there is no other facility which is nearby. Maybe the biggest facility, level 4, is Molo. So, Mr. Speaker, this is a high time the county government of Nakuru makes sure that they give this facility the required personnel so that they can give the services. Thank you, Mr. Speaker. I support.
Thank you. The Honorable Member for Viwandani, the Honorable Member for Bahati, and the Honorable Member for Maimayo. In that order, and then we are going to pick another round.
Thank you very much, Honorable Speaker. I have lost to support partially, and I think in my comments I will oppose, or I will ask some questions to the Chairman implementation, with your permission, Mr. Speaker. So, Mr. Speaker, in the committee's observations and recommendations, we've been here now for 1 year plus, giving reports on our health facilities. And the first observation and recommendation is that the county government of Nakuru should fast track and issue title deeds to all the health facilities and public facilities. But it is like it has been falling in deaf ears. So we need the committee and the chairman implementation, as I am waiting for the report of how far they have implemented all the reports, to make sure that whenever he is bringing the report in this house, he should make sure that the report is comprehensive and of details, so that we can be all satisfied. It is very shameful, Mr. Speaker, to have all kinds of war in our county regarding to our health facility, which is paramount to every citizen. It's a right to every person living in our county, because as legislatures we have passed all the required and good recommendations to make sure that our health facilities are working and running smoothly. So, Mr. Speaker, it is very simple to have a facility well equipped, as the committee has just said and indicated, whereas we don't have staffs to operate the facility as it has been equipped. So, Mr. Speaker, we need to pull up our socks as members of this House to make sure that everything that we pass here is fully implemented to the letter. It is in public domain that we are having wars in most of our health facilities, even in my ward, Naivasha. War Memorial here, which is in court, I don't want to dwell much in it. Now, the next one will be Moro, will be Marishoni, the other one will be in Bahati. So, if anyone or some group of people wake up one day, Mr. Speaker, and start claiming all these facilities, Mr. Speaker, we shall be having quarrels in our courts, in the publics, of which it is the laziness in the executive, which I must say, it is the laziness in the executive that they don't want to perform their duties as mandated by the Constitution and by the laws of this country. So, Mr. Speaker, I am here to support the report and to urge our members that we need now to work very serious. We need these people called here, answer this question, and give us the reason as to why they are not deploying the health workers in our hospitals, whereas our people are suffering. Mr. Speaker, if you have heard very well, they are having a lot of home deliveries. Mr. Speaker, it is evidence. If we can only have in a facility that is a level 4 with only one clinical officer, you ought not to take your wife or your daughter or your sister in that facility because you don't know how many mothers are in the line of delivery. So you opt to do it in your home. So, Mr. Speaker, we are risking lives of our people. We are risking lives of these newborns. So, Mr. Speaker, there is lack of integrity in those people who are mandated to perform these duties, to make sure that all the health facilities have adequate staffs. Mr. Speaker, you cannot believe that a facility depending on lanes to be clean at any given minute. Mr. Speaker, it's very shameful. Having heard that the first agenda of Her Excellency, the Governor, Susan Kehika in Nakuru, is water and health. Water, health. Then you hear that a facility is depending on rain. Mr. Speaker, it's shameful, and I urge this House to make sure that from now, everything that we have passed here is fully implemented to the letter. Thank you, Mr. Speaker.
Thank you, Honorable Member for Vuandani. The Honorable Member for Bahati.
Thank you, Mr. Speaker, sir. My name is Grace from Bahati Ward, and I stand here to support the report on the visit of Marioshoni Health Center, and I commend the Health Committee for the good job they are doing in doing abrupt visits to our facilities, which sometimes we are getting those people not aware and getting the facility at its peak. Now, I want to talk about something on this report. One, Mheshimiwa Speaker, the issue to do with title deeds are everywhere. Today, in the land that all of us live, unless you have a title deed, anybody can come from anywhere and throw you out from that land, knowing well that you are the one who owned it, you are the one who bought it, but because you don't have any legal documents that shows that you are in that plot, you are not the owner legally. So, I also wish to talk about the drugs. The drugs were flagged recently, but they are not enough. In the facilities that we visited, even the Mariashoni facility, there are no drugs like the diabetes, the high blood pressure. Even sometimes the Panadols are not there. And you fail to understand, a patient goes there and is told to go and buy the diabetic tablets outside the facility, which is very, very, very ashaming. And I would also wish to talk about the water. As a mother who has given birth, I know that water is crucial. Water can even bring some infections to women and the children. Because when a lady gives birth, and you don't wipe yourself, you don't wash the child, you don't wash yourself, the ward will smell badly, and everybody who comes to that facility won't love it at all. Again, Mr. Speaker, sir, I've read this report, and I was there myself. There is only one CEO in the facility and 3 nurses, and there is a maternity facility. I've not heard, or we didn't see any midwife in that facility. So I wonder who does the deliveries. Because everybody is trained to be in her station at a given time. We also have the shortage of nurses in our facilities, which is causing our services drag a little bit. You know, Mr. Speaker, sir, we are told, and we always say, that a healthy nation is a wealthy nation. If you want to be wealthy, you have to be healthy, because you can't go out to work when you are suffering from diseases. So I would also wish this Department of of Health and the Department of County Service Public Board, now that they have shortlisted the nurses and the CEOs and the health department, may they distribute these nurses and the medics equally to these facilities. Because you go to a place, the Mariashoni facility started in 2017, and yet, up to date, there are not enough medics in that facility. What about the ones who are coming up this time? I also wish to request the county government of Nakuru, which we serve all of us, and our governor, who is our CEO, to come up and urge the Department of Health, the executive department, the executive in our county, to be very, very, very aggressive on the health issues, to make sure that we receive the services as we are taxed. Because even as we are preparing the budget, we know that the lion's share goes to the health facility. And if it goes to the health facility and yet there are things that which are not done, we shall be sleeping on our area. So kindly, let everybody carry his or her cross and make sure that the department he is or she is leading comes the first, especially the health committee. I support the report, but let us pray that everything will be well. Thank you.
Mheshimiwa Maimayo, Mheshimiwa Lois.